5 on your mental health. We hear it from you, the viewers. You probably hear it from friends. Maybe you're feeling it yourself. Access to mental health care is scarce, even as the mental health crisis continues to impact so many families. But now a new program is trying to meet more people where they are, a change that can't come soon enough for a mom who knows this struggle all too well.
It was a full-time job, to be really honest.
Carrie Adams understands the frustration many families are facing right now. When first her daughter, then her grandkids needed mental health help, she ran into roadblock after roadblock.
It was a lot of phone calls. You'd call this person or this place, ask for things, and then they'd send you to another place.
Carrie kept at it, especially when the pandemic hit and she saw her grandson struggling.
Those years were really difficult for him. He lost friends, he lost connections at school. He started giving up, didn't want to try.
She's managed to find some help, but she and so many other families continue to hit those walls. And that's one reason behind a new pilot program at Mass General Hospital.
It can be very difficult and frustrating.
Dr. Catherine Brigham is part of that effort, pairing pediatricians at the hospital's primary care practices with mental health clinicians. The idea, to provide help and services as part of everyday care.
Children were really struggling with mental health concerns, and we were lacking a good way to hook them into care. Having psychologists work literally elbow to elbow with pediatricians in the same clinic, so that way when a concern is identified, we can meet it in the moment.
It was easy for me to understand why primary care needed mental health specialists.
Psychologists like Dr. Makiko Watanabe are now central to doctors' visits, something she says also serves another purpose.
When the patient is seen for their overall health needs, including behavioral health concerns in primary care, we can communicate an important message that mental health is health.
Dr. Brigham says the mental health clinicians in this program do much more than spot problems.
They've also at times identified very specific resources, helped them with the legwork of calling a therapist, making sure an appointment gets on the books, making sure that they're not lost when they leave the clinic and don't know what the next step is.
That is something Carrie Adams says could still help someone like her.
The problem right now is people don't know where to go or they're not available. The waiting lists are really long. If you can go to a pediatrician and say my child is having certain symptoms and so on, and they can very quickly turn that around and say, we have a person in the office you can talk to, that would be an amazing starting place.
Yeah, and Dr. Brigham says this kind of integrated model has been studied and has been shown to improve outcomes for kids who are struggling. She says the challenge now is rolling it out and making it affordable to private practices that may not have the resources of a hospital like MGH.